thanks for watching this video. Now, the reason you're watching this is you probably have questions about how your gums and your heart are connected and the health of your whole body. Maybe you've had gum disease, or you have recession, or you have lots of cavities. So recently, I've been doing a couple of radio interviews, NBC News Radio, Sirius XM, a couple other interviews on some national and local radio shows talking about this very topic, all right? So how do your gums connect to your heart and your overall health? Well, there are a few things we know, okay? Is if you have gum disease, your risk for stroke and heart disease is increased by 20 to 200%, all right? So by having unhealthy teeth and gums, it hurts your heart. And the reason is our mouths are red for a reason. There's lots of blood supply in our mouths. And so because of that, there's lots of flow. And so if there are bad things in our teeth or gums, they're getting into your blood and they're circulating around your body, and they can cause problems with your heart, okay? Now, with your gum health, okay, it's important, that you're seeing us twice a year, some people 3 times a year, some people 4 times a year, okay? I've never been diagnosed with gum disease, but I have my teeth checked, cleaned, and screened every 3 months because I know how important this is, and I have a genetic history of gum recession in my family, all right? So what is gum disease? If you have gum disease, it means you have pockets around your teeth. So if you can imagine that my hand is your tooth and my white sleeve here is your gums, okay? Healthy gums have just a little bit of movement like this, right? But if you have gum disease, you'll have these pockets that go like this, and we can take these special tools and measure, and they go way deep underneath it. And so what that means is that your bone is shrinking and your gums are pulling away from your teeth. Millions and even billions of bad bacteria can get in there, and you can't get them out with flossing and brushing, unfortunately. Those things can help prevent it, but once it's there, it will not take care of it on its own. So you'll need to see us for professional treatment or maintenance to make your gums better, okay? So gums and heart health, 20 to 200%, okay? 21% plus savings in medical care, okay? So a study was done, found that people with a healthy mouth had 21% or more average savings in overall medical costs. So some other common conditions with gum disease we see are diabetes, sleep apnea, acid reflux, and even types of cancers and Alzheimer's disease, right? So these are a couple of ones that are becoming more and more linked with gum disease. Are these, and diabetes is a really big one. Diabetes, heart disease, gum disease, we see those together all the time. They're all chronic conditions that a lot of times they're not painful, you're not having any major problems, maybe nothing hurts, maybe a little bit of bleeding, okay? But over time, what happens is it gets into your blood vessels, it can cause hardening of the blood vessels, cause bad circulation, cause problems in other parts of your body. So it's really important that you have your gums checked, okay? We do a full gum screening once a year on each patient, all right? The American Academy of Periodontology, just sort of like the board for gum health, okay? They recommend every year that you get a screening on your gum health. And so that's what we do here in our office. And we do that as part of your checkup. It's not an extra visit, it's just part of your checkup. We do that because we're committed to making sure that your heart stays healthy. All right, so in order to get your gums healthy, okay, there are some things you can do. Unfortunately, for most adults, brushing and flossing are no longer enough because most of us are keeping our teeth longer, we're living longer, we're getting implants and bridges and veneers. So we're keeping these in our mouth much longer than our grandparents did, sometimes even our parents. And so what that means for you, there's some other things you can do, all right? So these are the things we recommend. One is water, okay? Drinking more water. Soft drinks, diet drinks, drinks with added sweeteners are very harmful on your gums and teeth, okay? So more water. The second one is a water flosser, okay? We use one called the Air Floss Pro that we carry here we really like. Waterpik makes some good products. There's a few different ones. There's even one that will connect to your shower head. That's pretty cool. Okay, but using that around your implants, your bridges, underneath those hard to reach places, using that at least once a day to make to clean those hard to reach areas. Okay, and still use the good old fashioned string floss. Okay, or maybe a pick with a floss on it. Those are fine too. All right. But our best patients, they'll use some kind of water floss or irrigator once a day. And they'll use a string floss once a day and then brush twice a day. So our patients who do the best with keeping their teeth healthy, that's what they do. All right. The fifth one here is xylitol. Okay, that's a natural sugar that comes from trees and plants, and it's made into sweetener you can put on your fruit. It's made into candies, mints. You can get it in mouth rinse. But it's a sweetener. It's not an artificial sweetener. It is actually made from real sugar, but it is kind to your teeth. In fact, it can actually help make your teeth stronger. It's good for your sinuses, and it's a really good supplement to put into your day. Okay, and then the fifth one here is if you have sleep apnea, or you grind your teeth, or you're stressed, or you have TMJ problems. So TMJ, stress, sleep apnea. We have a whole bunch of different types of mouth guard depending on your condition, but you wear that at night or when you're stressed, and that prevents tooth on tooth, because tooth on tooth stress is very harmful to your teeth and gums. Can cause bad breath, can cause yellowing, causes your teeth to wear down, and you want to avoid that at all costs, right? Much better to buy a mouth guard because it's way less money than just one root canal that can be avoided by wearing something like this. So these are some things to keep in mind for your gums and your heart health. We'll go through, we have some different packages we can go through with you on what your options may be. We even have gum health products that also whiten your teeth at the same time that our patients really like, because you get that added benefit of teeth whitening. And really, we want to help you keep your teeth as long as you can. Implants are great, bridges are great for missing teeth or teeth that are broken, but if we can save your teeth and you would like to save your teeth, then we'll work together with you to help keep your gums and heart healthy. So we'll give you a sheet of instructions. We don't expect you to remember all of this along the way. We'll give you a packet of information that talks about diet, health, what to do at home, supplements you can use, foods you should eat, foods you should avoid that can really help you with your gums. So be sure to ask a team member, give us a call, and thanks for watching this video.